The main message is it's about inclusion and recognition of disability being about diversity. It's not something separate to other areas of diversity. Whilst we talk about inclusion and recognising that people have the same sorts of needs, I do think we have to think about what those specific needs might be in terms of particular groups. And for people with an intellectual disability, it's essentially about attitudes. It's about recognising that all people are sexual, all people have relationships, and all people will grow and develop through the life course. So, however, there will be differences in life experiences because of particularly intellectual disability and other disabilities. And primarily they are attitudinal, that people say might view people with an intellectual disability as more vulnerable and therefore think about the major need being around protection, as opposed to thinking about it in terms of, young people with an intellectual disability are young people first, and I guess normalising that education and support. What has stood in the way of people with an intellectual disability being involved and getting access to information, education and supports has been a fear that that it's too hard to provide that information and education in a way that people will understand it. There's been a dominant view that what is needed is protection, and there has been therefore an approach that has focused on very basic messages about protective behaviours. In terms of, I think, mainstream services like schools, health services, it's more about recognising that there is a service to be provided that should be provided to everyone in the community, and that, in my view, educators, sexual health nurses, community health nurses, doctors, all of the people who are essentially a resource around sexuality education can be a resource to people with an intellectual disability as well. And I think they need to perhaps just consider how accessible their services are and go about learning how to make them more accessible and more inclusive. And some of that is about particular resources. For some people it's resources in easy English. For some people it's about providing longer periods of time where you engage with people over a longer period of time, using stories, using resources that have been developed over time with people with an intellectual disability, and getting those resources into the mainstream.